The broadcast is now starting. All attendees are in listen-only mode.
Hi, and welcome to the Applied Science webinar. This is one of five-part series called the Brick by Brick series. This webinar explains why we need to know information on the board certification. There are additional study guide tools on our website at NCBTMB.org. Our presenters today are myself, Donna Sarvello. I'm the Vice President of Educational Support for NCBTMB, and I have been in this profession for over 20 years. I started as a massage therapist, moved into teaching, and now I'm with NCBTMB. My guest speaker today is Portia Resnick, the NCB President. Hi, Portia. Please tell us a little bit about yourself.
Hi, Donna. I am also a board certified massage therapist, as well as a board certified athletic trainer, and I have over 20 years of experience in the sports medicine field. I've previously worked as a clinical massage therapist and a massage therapist and massage therapy instructor, as well as working on massage therapy curriculum. Currently, I serve as an assistant professor at California State University, Long Beach in the Kinesiology department, where I also serve as a coordinator of clinical education for our athletic training program.
So you are definitely ready to tell us about applied science.
Yes, and to talk about not just the science, but how we actually use it in our massage practice.
Excellent. So, board certification. People ask me what board certification is. It is the highest credential in the massage therapy and bodywork profession. Choosing to become board certified demonstrates advanced assessment and critical thinking abilities, as well as provides instant credibility to current and prospective clients and employers.
People in the healthcare industry understand board certification as one of the highest credentials. Whether you're talking to physicians or nurses or athletic trainers, we all understand that board certification shows the highest commitment to our education, to our profession, to our clients, and to ourselves.
And we can join them with our credential.
Yes.
Okay. Board certification and applied science. As stated, it is the highest voluntary credential in the massage therapy profession. Today, we're going to go over anatomy, physiology, kinesiology, and pathology, and why you need to know it, why it's so important to know these areas. The research and education that we're going to talk about throughout the slides, because there are things that we've learned, as I stated, Portia and I have both been in the profession for over 20 years, and things that we learned in school do not hold true today because we have researchers now that show us the importance of getting facts.
And I would like to thank our friends at the Massage Therapy Foundation who've been with our profession for over 30 years for their commitment to bringing research to massage therapists. We learn in school the basic anatomy, physiology, and kinesiology, and typically we learn them in that normal state within the body. And by understanding how they function optimally, we can help understand when there is pathology, when something isn't correct, so that we can work with our clients to bring them back into homeostasis. And keep in mind, a lot of our education came from textbooks, and the more we learn and the more research we do, the more updated the textbooks become, but they still sometimes lag. So for the most up-to-date research, visit our friends at the Massage Therapy Foundation.
And I just want to add, in speaking to Massage Therapy Foundation people, previously doctors would do our research for us and they weren't in the massage therapy profession. But now more and more massage therapists are actually doing their own research, which is so important to our profession.
It is.
Okay, so today we're going to talk about the primary systems of the body. The functions, the effects of massage, the pathologies, and the contraindications. So, Portia, we're going to start with the musculoskeletal system. Can you explain a little bit about that for us?
Absolutely. This is my favorite of all of the systems. I love talking about this, the bones and that how they create the structure and the framework and how they create the joints that provide movement, as well as our skeletal muscles that move us through all of our different actions and help our body be able to perform all of the skills that we do, even massage. And as massage therapists, this is the system we probably spend the most time with to try to help alleviate tension, to try to alleviate some of those sore muscles, and to help our clients just to feel better. We need to understand some of the pathologies and how we can help with them. For example, if somebody has an acute strain or sprain, we want to make sure that we're not working on it in that acute phase, but once we get into that subacute or even in that chronic phase, that we're working through those areas. We also want to be able to understand things like, for example, if a runner comes to us with knee pain, are we just looking at the knee, or do we know better, that we know that we need to assess the hip? Maybe it's an IT band issue that's coming from the hip. Maybe there's a problem down in the lower leg that we need to address that can kind of help alleviate some of that knee pain. Or, like most of our clients, they're spending a lot of time sitting at a desk working on a computer. And so they have some of that upper back and neck soreness. And what we want to do is be able to relieve that for them and give them some good tips and techniques so that they can work safely at their job.
Excellent. And part of the research has shown us that there are no toxins in the body that water gets rid of. So we used to always tell our clients to drink water to remove the toxins that we've loosened. That no longer stands true.
Thank you to research for pointing that out to us.
Excellent. So the nervous system, can you tell us about the functions and effects of massage on the nervous system?
Sure, and just as a quick reminder, the way our nervous system communicates is through neurotransmitters, which cross over the neuromuscular junctions. So when our nerves are talking to our muscles, they're doing so through acetylcholine, which is the neurotransmitter that's kind of crossing over into the muscles. And when we look at the effects of massage has some great effects on that musculoskeletal system in working in conjunction with the nervous system. So for example, let's say your athlete has a cramp in their calf muscle. That tightness in the muscle is creating a mechanical pain that's putting pressure on the nerve. That nerve is sending signals up to the brain, which is then releasing chemicals to produce chemical pain, which produces more spasm, more mechanical pain, which produces more chemical pain. And we get into this pain, spasm, pain cycle. We can use massage to help alleviate that tension, that tightness in the muscle, to take the mechanical pressure off of the nerve, and then that will alleviate the chemicals from being released and break up that pain, spasm, pain cycle. So understanding how not just the nervous system functions, but how it functions in conjunction with that musculoskeletal system can really give us relief for our clients.
Yeah, and when we talk about other pathologies, we can look at peripheral neuropathy and how to work with that and the pressure needed or the lighter pressure needed to cause no harm to your clients.
And also with that, if we're using any adjunct therapies, like for example, heat or cold, we want to understand that they may not be able to gauge temperature quite so well. And so we might want to avoid those particular modalities for that client.
Okay, let's move on to the cardiovascular system, the functions and effects of massage therapy on that.
So the cardiovascular system is a combination with our heart and our blood moving through the blood vessels. So from the left side of our heart, we pump oxygenated blood throughout the body, and then our deoxygenated blood returns to the right side of the heart. So massage has some influence on the movement of fluid, although it's really more on a superficial level in order to help move fluid through our system.
And as Portia indicated, it is superficial. So when we talk about that research, we used to say that massage increases the flow of blood or cardiovascular system. And that's not necessarily true. But when we look at pathologies, say working with a pregnant woman, we want to make sure that we don't press too hard, or we check in with our clients to make sure that there's no thrombus or thrombi deep in the thigh muscles. We want to make sure that the pregnant woman has had regular doctor's appointments to make sure there are no health concerns. All right. And now let's move on to the lymphatic system. What are the functions and effects of massage therapy on the lymphatic system?
So the lymphatic system is our overflow for the fluid from our cardiovascular system. So plasma, which is the fluid portion of the blood, when that leaks out of the capillaries as it's providing oxygen and nutrients to our working organs, some of the fluid doesn't get taken up. So that kind of stays in the system, and that gets taken up by our lymphatic system, which handles the overflow. I always liken the lymphatic system to that overflow of our drain in our sink. And what can happen is sometimes we can have a known injury. Like, for example, if I sprain my ankle and that ankle gets swollen, then we know we have this inflammation that is this plasma that is leaked out of the circulatory system, and we know why it's there. In other cases, a client may come to us and they may have swelling that they don't know where it came from. They don't have any history of injury. And those are the things that we need to be aware of. Is it known swelling, or is it unknown? Is it coming from another area? And also our massage therapists who have taken some specialty courses in manual lymphatic drainage, those are some of the best people to refer to if we have a client that comes to us with some different types of swelling.
Yeah, and when we talk about oncology, a lot of massage therapists are now working with cancer patients. They have to understand that sometimes lymph nodes are removed if they're affected by cancer, and that can cause additional swelling in an extremity. So we really do have to be educated in that area in manual lymphatic drainage. Another thing I want to bring up that isn't well known is that doctors and scientists and researchers have found that icing inflammation and acute injuries probably isn't the best idea, because we need all of those cells in there, the white blood cells, cleaning out the area, and that's what causes the swelling. So if you are going to ice an area for pain, the recommendation is only 10 minutes and then remove the ice.
And that's the current research that we know from today. But we all know research sometimes changes.
Absolutely. So let's talk about the respiratory system. Tell us a little bit about the functions and effects of massage on the respiratory system.
So respiratory system is basically looking at our lungs, looking at our breathing and how we're taking in oxygen. So the blood that flows from the right side of the heart goes to our lungs, where it picks up oxygen, drops off carbon dioxide, then returns to the left side of our heart before going through our system. And so massage is actually beneficial to people who have some respiratory conditions. For example, if you have an asthmatic who may have some dysfunctions in their breathing, those accessory breathing muscles may require a little bit of extra attention in order to get them working correctly. Or even in a lack of pathology, if let's say we're working with performance artists, such as singers, they may actually have some tension in those muscles as they're trying to sing out to the crowd and really use those accessory breathing muscles. So if you work with any performance artists, it's a good idea to become familiar with those muscles and be able to work with them.
Yeah, and in the respiratory system, a lot of doctors are realizing how much massage does for people, say, with pneumonia, chronic pneumonia. So I have a friend who actually gets referrals from hospitals and clinics because he's had training on how to work with pneumonia patients. So what he does is he has to know how to position the client first. So he positions the client so the head is a little bit lower than the body, or the upper body is a little bit lower than the legs. And he does percussion on the back behind the lungs. And he has great response from doing that. He has patients that are phlegm-free because they're able to get all of that mucus out within 2 to 3 weeks. So if you're interested in joining that, there's another avenue that massage therapists can look at.
And getting back to positioning, let's say we do have somebody with some breathing difficulties. They may not be able to lie prone or lie supine and be comfortable and feel like they can get that air in. So we might need to put them in a semi-reclined position or a side-lying position to work on them. And one of the things we know is how to translate our massage to people in different positions so that we can reach everybody and make sure that massage can touch everybody.
Yes, good point, Portia. So, the endocrine system. Let's talk a little bit about the function and effects of the endocrine system.
So the endocrine system is a crossover a little bit with our nervous system. Our endocrine system deals with the hormones and the hormones and the chemical responses with the body. So one of the things that we know is that the effects of touch has such a positive effect on our body. Even something such as a Swedish massage will increase that parasympathetic nervous system and increase those positive hormones and those positive neurotransmitters. While there aren't very many pathologies that could have a negative impact with massage, one of the things we have to understand is, for example, diabetic, and diabetes is an endocrine system dysfunction where the pancreas is not working correctly. Let's say you have a diabetic client on your table and they took their insulin but haven't had anything to eat that day. We as massage therapists need to understand and recognize if their glucose levels have dropped, that could be a diabetic emergency. And we need to understand how to handle and how to best help those clients in an emergency situation.
Yes, I agree. When working with those clients, we should make sure that number one, they do have insulin with them just in case. And number two, keep some juice, some orange juice, or keep, a couple of small candy bars on hand in case they need them. Okay, the integumentary system, which is the largest organ of the body. Tell us a little bit about the functions and effects of massage on the integumentary system.
Well, of course, this is our skin. So this is the area of the body that we are touching. This is what our skin, our hands, or forearms, or feet, if we're talking about that type of massage, what we are touching on our clients. So we need to be able to understand the sensory receptors in the skin, that they're feeling our touch, that they're feeling, for example, heat or cold. But one of the biggest things to understand with the integumentary system, what I always like to call, if it's icky, don't touch it. We need to understand skin pathologies so that we understand what might be contagious, so that we don't spread pathologies across our clients or get something on our hands, and we follow those good universal precautions. At the same time, we need to understand what pathologies are not contagious. For example, something like psoriasis or eczema, which just affects our clients and isn't contagious and isn't going to affect us, we wouldn't want to deny this person the ability to have touch because we don't understand that it's not a contagious pathology.
Yeah, in talking about that research again, when I graduated from massage therapy school, I was under the impression that if somebody had impetigo anywhere on their body, it was a general contraindication. And we were supposed to tell the client to come back when it had cleared. And now we find we can still work on clients. That's just a local contraindication. So I encourage everybody to check research and how it's changed over the years. And then for more information, you can contact us at www.ncbtmb.org/certificates, or call us, or you can email the info at ncbtmb.org. And the last is our resource site. Thank you for your time in learning with us about the board certification exam, there is much more information at our website. There's a study guide for the board certification. There's an outline. We have an online practice tool that can help everybody for everything. Schools can use it for their students to see how they're doing. And last but not least, I do want to give a shout out to the Massage Therapy Foundation. Their website is www.massagetherapyfoundation.org. Portia, thank you so much for joining me in this.
Donna, thank you so much for having me. And to all of you who are listening, come join us and be board certified massage therapists.
The highest voluntary credential within the profession.